it'll be anywhere like 95% of thyroid conditions are autoimmune, according, again, to the research. That means 90 to 95% of people with hyperthyroidism have Graves, 90 to 95% of people with hypothyroidism have Hashimoto's. And so you want to do everything to optimize the immune system to optimize the health of the thyroid. So one of the ways you do that is by having a healthy gut. And there's a few reasons for that.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In today's episode, I'm joined by Dr. Eric Osansky to explore the fascinating connection between gut health and thyroid function. Many people struggling with thyroid issues focus solely on the gland itself, but what if the root cause lies in the gut? Dr. Osansky, a functional medicine practitioner specializing in thyroid health, shares how an imbalanced gut can lead to inflammation, autoimmune reactions, and hormonal disruptions that directly impact thyroid function. We discuss the key signs of gut dysfunction, how to restore balance, and practical steps you can take to improve both your digestive and thyroid health naturally. If you or someone you know is dealing with hypothyroidism, Graves' disease, Hashimoto's, or any other thyroid-related concerns, you won't want to miss this one. Stay tuned to discover why healing the gut is often the missing piece to optimizing thyroid function and overall well-being. Eric Osansky, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you so much, Lee. Appreciate you having me.
Yeah, it's great to have you on, Eric. And to kick things off, could you share your educational and professional background and what motivated you to become interested in helping people with thyroid issues?
Yeah, so my background is actually a chiropractor, and I graduated in 1999 and had a traditional chiropractic practice for, I guess, about 7.5, 8 years, and was diagnosed with hyperthyroidism and eventually Graves' disease. And then just was able to, in a nutshell, restore my health and do it without taking the anti-thyroid medication that's commonly recommended, and just was really passionate about helping others with thyroid and autoimmune thyroid conditions. And I could get more in the story if you want me to. But
yeah, please do.
Yeah. Oh, sure. So so I mean, this happened in 2007 actually is when it started, when I was dieting and detoxifying, and I was trying to lose weight. I was a little bit overweight at the time, and I was successful in losing weight, but little did I know that a lot of the weight loss was related to hyperthyroidism. I ended up losing a total of 42 pounds, and I didn't weigh that much. I mean, I wasn't that much overweight. I was like 182, trying to get down to like the 160s, but went below that. And one day I was walking around in a retail store, and they have those automated blood pressure cuffs, and I took my blood pressure, which was fine, but my resting heart rate was 90, which obviously a little bit on the higher end. So the next few days I would just manually check my heart rate. Was anywhere between 90 and 110 beats per minute. And so I realized something was up, and went to see a primary care doctor who diagnosed me with hyperthyroidism. A few months later, was able to get in for an appointment with the endocrinologist, and she's the one that officially diagnosed me with Graves' disease. And at that time, I wasn't too familiar with hyperthyroidism, Graves' disease, other than what I learned at some conferences. And when I attended conferences back then, they were always nutritional conferences, like to get my CE credits, my continuing education credits. And I did attend a couple of functional endocrinology seminars that spoke about thyroid health and natural methods for hyperthyroidism, Graves', for Hashimoto's. Little did I know I would need those approaches for myself. But thankfully I did attend those because I realized that there is a natural option, and I didn't know if it would work. I was skeptical because I was the first one I really knew who had Graves' disease. But
Mm.
I made some changes from a diet perspective, did some functional medicine testing, took some supplements, and this was fall 2008 when I started after the diagnosis from the endocrinologist, and then into 2009 continued to working on restoring my health. And yeah, so I've been in remission. Some will say I'm cured. Again, I mean, because there is a genetic component, I'm hesitant to say I'm permanently cured, even though I feel like I'm cured. But since
Mm.
2009, I've been feeling great. I mean, I've had some health scares like chronic Lyme disease, for example, and a few other shingles, and some cases where I thought maybe I would relapse, but thankfully I didn't. And like I said, I've been helping people with thyroid and autoimmune thyroid conditions ever since 2009.
Mm. Yeah, for the audience, could you explain what Graves' disease is? Because obviously, some people listening to this may not know what Graves' disease is. Could you actually explain what that is?
Yeah, so Graves' disease is an autoimmune condition that affects the thyroid gland. So what happens that there's actually two types of autoimmune thyroid conditions. The more common one is Hashimoto's thyroiditis, which again involves the thyroid, but it's more of an immune system condition. And so what just to compare with Hashimoto's, you have the immune system attacking the thyroid gland, damaging the thyroid, and that over time can lead to the thyroid hormones getting low and eventually out of range, lead to hypothyroidism. So with Graves, it's the immune system attacking the TSH receptors of the thyroid, and this leads to the excess production of thyroid hormones. So it's not destroying the thyroid, damaging the thyroid like the immune system is in Hashimoto's. It's more like stimulating the thyroid, and that's excess stimulation leads to thyroid hormone production and too much thyroid hormone production, and that on a blood test that would present as elevated T3, T4, TSH, which is thyroid stimulating hormone, and that's a pituitary hormone, will be undetectable just because it's trying to tell the thyroid that we don't want to produce any thyroid hormone. Whereas, like with Hashimoto's, the opposite. Usually, you see TSH on the higher side and thyroid hormone levels on the lower side. So TSH is high to communicate to the thyroid gland to produce more thyroid hormone. But yeah, as far as like symptoms, I mentioned I had the elevated resting heart rate, I had heart palpitations, tremors. I mentioned the weight loss, which is pretty common with hyperthyroidism. Not everybody, but it is one of the classic symptoms. Anxiety, insomnia, some other symptoms, sometimes loose stools. So it's kind of accelerating everything. Whereas,
Mm.
like, again, Hashimoto is the opposite. You get that the lowered metabolism. So you get weight gain, fatigue, coldness. Whereas again, with Graves, everything is pretty much sped up.
Mm. Yeah, because the thyroid is pretty much like an accelerator pedal on a well, it's kind of like the accelerator on a brake, isn't it? So Graves' disease, the accelerator's stuck on, whereas with Hashimoto's, it's more like the handbrake is stuck on, kind of thing, as an analogy.
Yeah, essentially, yeah, you're right. It's I mean, a scary condition to deal with when you have that elevated resting heart rate, and then you go on the internet and you read about things such as a thyroid storm, which is a medical emergency when thyroid hormones are really high and you're not appropriately managing the hyperthyroidism. And again, in rare cases, but in some cases, it again can be lethal, like it can be fatal. So it is important, even though I take a natural approach or took a natural approach and recommend a natural approach to my patients, there is a time and place for anti-thyroid medications such as methimazole. I mean, you do want to be safe while addressing the cause of the problem. So I'm definitely not opposed to the medication. The problem with Graves is that most practitioners, including endocrinologists, will usually recommend, if in addition to the medication, they commonly recommend either radioactive iodine, which ablates the thyroid gland, pretty much destroys the cells of the thyroid, or thyroid surgery, which of course involves removing the thyroid gland. And not to say there isn't a time and place for that, but again, the problem is with Graves, it's an immune system condition. So if you kill the thyroid or remove the thyroid, you're not doing anything to address the cause of the problem. You're helping with the thyroid problem, like that.
Mm.
Yes, if you remove the thyroid gland, you're not going to have hyperthyroidism anymore, but you're going to still have the autoimmune component. And the concern with that, at least one of the concerns, is someone who has one autoimmune condition is more likely to develop other autoimmune conditions as well.
Mm.
So the person, they might develop Hashimoto's or rheumatoid arthritis or lupus, or there are, as you know, so many other autoimmune conditions one
Mm.
can develop.
Yeah. Yeah. So the important thing really is you got to treat the root cause of the problem rather than just treating the symptom of the problem, so to speak.
That is correct. Yes,
Yeah.
definitely.
Yeah. Now, the other thing as well, um, maybe we can just touch on, and maybe we'll go into more detail towards the end, but can you just talk a little bit about the books that you've written as well?
Sure. So in 2011, I wrote my first book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. And then a couple of years later, 2013, I came out with the second edition of that. And then just recently in fall of 2023, I updated it a third time. And so a third edition is out. That's so 10 years later, after the second edition, I finally updated it again. Also have the audiobook version of that out as well on Audible. And then 2018, I wrote my first book on Hashimoto's triggers, and that goes into detail all of the different triggers that can cause Hashimoto's. And then in 2024, spring of 2024, I came out with another book on hyperthyroidism called The Hyperthyroid Healing Diet, which talks about some of the different diet options that could help people with hyperthyroidism. So those are the three thyroid-related books that I've written.
Yeah, amazing. It's not often I get someone on my podcast that's written almost as many books as I have. So well done on that. I
Thank
know
you.
how much hard work goes into writing books, but I've never got round to writing a second edition. That's just that's for me. That's just going too far. But well done to you for doing that. Because I know, as soon as you write a book, 6 weeks later there might be something in there and you think, oh, that's been updated. Now I need to change that. But yeah,
Yeah.
I've learned to let go in
Well,
life. So
yeah, and with I guess also with the reasoning, the third time, maybe not a good reason the second time because it was only 2 years later, but the third time I decided to do it 10 years later was also I wanted to do the audiobook, and I could have just
mm,
recorded the did the audiobook for the second edition, but I'm like, if I'm going to record the audiobook version, uh, then I might as well just update it.
mm,
And I mean, it definitely took work. It's not as much work as writing a new book,
yeah,
but yeah, it probably still took like 5, 6 months to go through it again and just update the research and all that. So it definitely was work. But yeah, I don't know if there'll be a fourth edition anytime in the
yeah,
future. But yeah, that's the reason why I did decide to revise it a third time.
excellent. Yeah, well done for that. Um, so the kind of main topic I guess I wanted to speak to you about is, why is it that, or how is it that gut health plays a role in the health of the thyroid? Are you struggling with digestive issues, fatigue, or simply feeling like your body isn't performing at its best? Well, let me tell you about Victoria. Victoria came to me to prepare for her second London Marathon, looking to optimize her fueling and improve her performance. What we uncovered went beyond her training plan. Through our work together, we discovered that Victoria had been living with a range of food intolerances that were impacting her health, something she had dealt with for over 20 years. She was unaware that symptoms like bloating, discomfort, and fatigue were signs of serious food sensitivities. After running tests, we identified that she was gluten intolerant and sensitive to egg whites and soya. Once we removed those foods and focused on her unique metabolic type, Victoria started seeing incredible changes. She lost weight, has a permanently flat stomach, and is living pain-free. Her energy levels are higher, her skin is clearer, and she feels better than ever. Now Victoria enjoys her favorite treats in moderation because health isn't about perfection, it's about balance. She's happier, healthier, and living a life free from the discomforts that used to hold her back. If you're ready to uncover what's really going on with your health, let's work together to create a personalized plan that will transform how you feel. Reach out today at www.bodycheck.co.uk and start your journey to a healthier, happier you.
Yeah, I mean, with I mean, as you know, all there's the saying, all health starts in the gut.
Mm,
And there's a few different ways that having a healthy gut is important when it comes to having thyroid health. I mean, so most thyroid conditions are autoimmune. So I mentioned, my experience with Graves. I spoke briefly about Hashimoto's thyroiditis, which is another autoimmune condition. So depending on the resource where you read, it'll be anywhere like 95% of thyroid conditions are autoimmune, according again to the research. So that means 90 to 95% of people with hyperthyroidism have Graves, 90 to 95% of people with hypothyroidism have Hashimoto's. And so you want to do everything to optimize the immune system to optimize the health of the thyroid. So one of the ways you do that is by having a healthy gut. And there's a few reasons for that. One reason, as you know, is that most of the immune system cells, or at least the majority, like 70, again, depends on the source you read, but 70 to 80% of the immune cells are located in the gastrointestinal tract. And then there's also what's called the Triad of Autoimmunity, also known as the three-legged stool of autoimmunity. And according to this triad, there are three components necessary for autoimmunity to develop. One is a genetic predisposition, which obviously we can't do anything to change our genetics. We can do things to modify the expression of our genes through diet and lifestyle. But there's the genetics, there's exposure to one or more environmental triggers. And we could definitely talk more about the different triggers that could impact our health and be an autoimmune trigger, but also affect the gut, which again, we're talking about here, the relationship between gut and thyroid. So again, triggers. Third is that increase in intestinal permeability, which is that medical term for a leaky gut. So, according again to the literature, it seems that having that leaky gut is also necessary for autoimmunity to develop. And so, if you have that leaky gut, that's going to play a role in development of Graves and Hashimoto's, along with, again, having the genetic predisposition as well as exposure to one or more environmental triggers. And then, like I said, the immune system cells being located in the gut as well is a factor. So yeah, it's not, I wouldn't say a direct relationship as far as the gut and the thyroid, but since, again, most thyroid conditions are autoimmune, it really is, I don't want to say impossible, but almost impossible to reverse autoimmunity if you don't have a healthy gut. And again, we can make the argument that maybe it is impossible to reverse autoimmunity without having, and maybe when we say a healthy gut, again, it doesn't mean it's going to be 100% perfect. Like if you do a comprehensive stool panel and you might still see some minor dysbiosis, which is, imbalance in the gut flora. But if you have some severe gut disturbances, then it really is going to be difficult to reverse that autoimmune component of Graves and Hashimoto's.
mm. Yeah, and with the intestinal permeability side of it, obviously, if the gut is leaky, which is what permeability means, then there are things getting into the bloodstream that shouldn't really be getting in there, whether it's undigested food particles or whether it's certain toxins or whatever it might be. And then obviously the job of the immune system is to attack and deal with things that it doesn't identify as being human. So if the food isn't getting broken down properly, it won't be recognizing, let's say amino acids. It might be recognizing let's just call it a lump of steak. It probably wouldn't be a lump of steak, but you get the idea. Or it might be certain toxins, might be endotoxins from the bacteria in the gut, let's say. That's creating an immune response and then potentially creating systemic inflammation. is that really at least in part, a summary of the mechanism that could well be causing the autoimmunity?
Yeah, I mean, you did good. So yeah, I would say, like you said, I mean, if you have that increased permeability, you're going to have food potentially again, food particles, or like you said, you would talk about endotoxins like lipopolysaccharides that could play a role. So all these things can pass through the intestinal barrier when they normally shouldn't. And you're absolutely right. That will cause immune system activation, systemic inflammation, and this definitely plays a big role when it comes to autoimmunity. And again, not just Graves, Hashimoto's, but
Mm.
other autoimmune conditions as well.
Yeah, yeah. So, in your view, what would you say? What's the difference between immunity and autoimmunity?
Yeah, well, immunity is, I mean, we need a healthy immune system. We need, when you do a blood count is here. It's called CBC. I think UK just might be called blood count. But either way, when we look at like white blood cells and a breakdown like neutrophils, lymphocytes, eosinophils, basophils, monocytes. I mean, again, those are a part of a normal immune system, and when we the immune system has many different functions. One is to protect us from illnesses, for example, like viruses. I mean, and we could talk more about viruses, but I think more about like viruses like COVID, Epstein-Barr is more of an immune system problem than a virus problem. And so yeah, immune system is with autoimmunity, it's an abnormal response. It's again, our body's not supposed to attack our own tissues of the body, or again, maybe in Graves, it's not like damaging, but still stimulating the TSH receptors. So again, it's not with immunity. It's it's a good thing. We want to have
Mm,
healthy immunity for again for protection, and as we age, it's important. Whereas autoimmunity, it's the opposite. Obviously, it's having a negative effect on our bodily tissues, and again, it goes beyond just Graves and Hashimoto's, but other autoimmune conditions. I mean, certainly there are autoimmune conditions worse than Hashimoto's and Graves that really could be. I mean, not that Graves and Hashimoto's can't be debilitating, but these some autoimmune conditions. I mean, rheumatoid arthritis in severe cases, can really be debilitating. Again, Sjogren's disease. I mean, MS, of course.
mm,
So again, autoimmunity is there's really, I wouldn't say anything positive about autoimmunity.
mm,
Whereas, like, to have natural immunity, that's what everybody wants. You want to have that healthy, thriving immune system.
mm. Yeah, I think there's a couple of things when I kind of look at autoimmunity. I kind of look at the first thing is it's almost like an overstimulation of the immune system. And then the second part of it is something's going wrong in terms of identifying self and non self. Because obviously the immune system is there to attack non self, but with autoimmunity, the immune system is attacking self. Would you agree with that?
Yeah, yeah, exactly. So that's a great. Yeah, I mean that's exactly what's happening. I mean, yeah, and again, there's still not a lot there's still a lot that we don't know. I mean, there's a
Mm,
lot that we've learned over the years about autoimmunity. But yeah, as you said, distinguishing self from non-self. There's I'm sure you're familiar with like molecular mimicry,
mm,
where the body gets confused, where like the amino acids from, like, for example, infections. Certain infections can have an amino acid sequence similar to, or certain infections have a sequence similar to our amino acids, and so the body kind of mistakes the infection for, and that causes damage to the part of the body. Same thing with environmental toxins. So yeah, I mean, he said it in a simple way, and it's true. Like pretty much, it's self versus non-self kind of determining and things when it comes to autoimmunity. The system, just to put it in lay terms, gets all out of
mm.
whack, and the body, no longer has that ability to distinguish self from a non-self.
Yeah. Yeah, I think the first time I come across cell mimicry was, I think it was Lauren Cordain wrote a paper about gluten and how synovial fluid in joints has a DNA that's almost identical to gluten. So if you have a sensitivity to gluten, the immune system obviously will start attacking gluten cells in your bloodstream, but then it will also start attacking synovial or synovium in your joints, right? So then the very act of eating gluten-containing foods could cause an arthritic type condition, or at least pain in the joints. I had someone on the podcast recently that kind of didn't believe that that was accurate or true. I can't remember the reasoning behind it. But what's your stance? Do you believe that is a true and accurate statement?
Well, it's interesting you mentioned that. I don't know if you're familiar with Dr. Tatis Karazian,
No.
who's yeah, so he's big. Well, he used to be bigger in the thyroid space. He has a book on Hashimoto's, also has a brain-based book that I think was released in like 2016. And so, but very, very knowledgeable. He's taught for the Institute of Functional Medicine. If you're familiar with Cyrex Labs, I don't know if he's still on the board for Cyrex, but or at least was affiliated with Cyrex Labs, like helping with some of their panels. And so he actually mentioned that with the thyroid too at one time, and where the amino acid sequence of gluten is similar, like the some of the proteins in gluten similar to like the amino acid sequence of the thyroid. So there's the possibility that if someone eats gluten, that the immune system will get confused. And again, I'm sure he didn't say exactly like this,
Mm,
but essentially what you're saying about the synovial joints, that if someone
mm,
eats gluten, that in a case of mistaken identity, the body, instead of attacking the gluten, will attack the thyroid. Now, I did look in the research, and I mean, from a research perspective, like in PubMed, I could not find anything to prove that. Now, that doesn't mean that it's not the case. Same thing with the
mm,
synovial joints. I haven't researched, so I don't know if there is that relationship. But and that's what I was saying. You know, there's so much about the body that we don't know. Some of this
mm.
is theory, and then years from now, some of this will be proven to be right. Some of it will be proven to be wrong, and we'll have different theories.
Yeah.
But yeah, I mean, it does sound like a viable theory. Whether or not that's the case, I'm not sure. But either way, I recommend for people I work with to avoid gluten, not just
Mm,
for that reason, but as we both know, gluten also could affect that permeability of the
yeah.
gut. Could also, so besides, maybe it does directly cause damage or cause the immune system to directly damage the synovial joints, maybe even the thyroid. But even if it doesn't have that effect, it could affect permeability of the gut, which
Mm.
is part of that triad of autoimmunity, and could therefore even indirectly lead to that autoimmune response.
Yeah. Yeah, for sure. I mean, gluten has been suggested to stimulate the release of zonulin, hasn't it, in the lining of the gut wall, which opens up those tight junctions and it increases that permeability, at least in some people anyway. So that backs up what you were saying. So would you say it's possible to heal the gut without having a healing effect on the thyroid?
So would it be possible to heal the gut and not have a beneficial effect on the thyroid?
Yeah. Did you know that 92% of people fail to follow through on their New Year's resolutions? That's right. Year after year, most of us start strong and then lose momentum by February. Sound familiar? But what if this year could be different? What if you finally had the tools to make your goals stick? Introducing Stickability, a simple, effective, and affordable program designed to help you overcome the cycle of failed resolutions. In just a short time, you'll learn how to create lasting habits without wasting hours or breaking the bank. This isn't just another plan. It's the solution to finally sticking to your healthy lifestyle goals. Don't let this year be like the last. Head over to stickabilitycourse.com now to enroll. It's affordable, easy to follow, and packed with tools to make 2025 the year that you have the ability to make it stick?
Well, I mean, I would say in the case of Graves' Hashimoto's, no. Now, there might be other things that you need to do. So I will
Mm,
say that if you're going to, if someone focuses on healing the gut, without question, it will benefit those with Graves and Hashimoto's. The question though is if you heal the gut alone, is that going to heal the thyroid or
mm,
reverse autoimmunity and in turn heal the thyroid? And I mean, the answer is no for, I mean, there's a few reasons. One is that there could be other imbalances in the body. Now, we could say like nutrient deficiencies. If someone has nutrient deficiencies, maybe that's related to the gut. So you correct the gut, you heal the gut, and then in turn, correct the nutrient deficiencies. But then there could be other factors that are playing a role as well, like increased toxic load. And a lot of these toxins out there are toxins, toxicants, they
mm,
could actually in turn affect the thyroid. I'm sorry, affect that they kind of actually affect the thyroid as endocrine disrupting chemicals, but also some of them can affect the gut as well, the permeability. But then besides affecting the gut, like I said, some of them could also affect the thyroid. So even if you have a healthy gut and if there are certain toxins that are affecting the thyroid gland that so yeah, having a healthy gut definitely is important for Graves and Hashimoto's and again other autoimmune conditions, but it doesn't always resolve the thyroid condition just by healing the gut because there you might need to address other imbalances like
mm.
adrenals. I mean, in
Yeah,
my case,
yeah,
stress was a big factor, and again, we could make the connection. Well, the adrenal stress will also affect the gut, so we could put the pieces together, regardless of what we're saying, whether it's
yeah.
toxins, toxicants, adrenals, it all correlate to the gut health. But I guess I just don't want anybody to think all you have to do is just heal the gut and you don't have to worry about some of these other imbalances in other areas. Because I think just as you know, we want to look at the whole body and the gut, though, definitely plays a big role in this.
Yeah, yeah, for sure. So, would you agree that it would be fair to say that one of the foundations, one of the essentials, if you like, for a healthy thyroid would be a healthy gut? And
Yeah,
then,
100%. Oh, 100%. Yeah. Yes.
another, let's call them foundations, would be, uh, how can I put it right? I don't want to necessarily say it's the adrenal glands, but you want to be in a, let's call it a parasympathetic state most of the time rather than in a
Hmm.
sympathetic state.
Yes.
That would be important. And then you would probably need to minimize, first of all, toxic load and possibly optimize the release of toxins that you've already accumulated in the body. Would that be fair?
Yeah, that would be fair.
Okay. And would there be anything else to add to that in your experience?
In addition to having a like being parasympathetic, more
Yeah.
parasympathetic dominant, and then having reduced toxic burden, and then I mean the three things that I talk about, kind of what we just said. So,
Mm,
and again, not to say it's only those three things, but um, yeah, having healthy adrenals, parasympathetic, more parasympathetic dominance than sympathetic dominance, reduced toxic burden, healthy gut. Most of these other things we could tie into these things. So
mm,
again, like the nutrient
yeah.
deficiencies. Again, not to say it's always related to the gut. Maybe it's again, if we have increased toxic burden, that's also going to require the use of more nutrients,
Mm,
as well. Mitochondria, of course, important for, I mean, very dependent on nutrients. But yeah, like I said, we could pretty much interrelate all three of these together. And
mm,
I mean, I'd say in a simplistic term, healthy liver, healthy adrenals, healthy gut, healthy liver. And I mean, in most cases, you're going to have healthy immune system, healthy thyroid.
mm, yeah. And again, in terms of nutrients, you probably need to be eating a good diet as well, right? So high quality foods, unprocessed foods, and
Definitely.
avoiding your simple sugars and possibly, flours made from grain and your seed oils and all those kind of things as well that can potentially deplete your nutrient content.
Yeah, exactly. I mean, great point. If you're eating fast food, refined foods, unhealthy oils, you're not getting enough nutrients, not getting enough protein, then you could try to do other things to heal the gut. And again, it's yeah, not you're not, it's obviously not going to correct the nutrient deficiencies if you're not getting enough nutrients from the food you eat. So you're right. I mean, same thing with the with the stress. I mean, we have to incorporate stress management techniques, maybe incorporate some vagus nerve exercises for that, try to get that parasympathetic dominant state. So yeah, we that's where diet and lifestyle play such a key role in having healthy adrenals, healthy liver, healthy gut.
Mm. Yeah, and I guess the other thing that would be important as well is not just eating the right foods, but being able to digest and assimilate those foods so that you do have the nutrients available, right? Which again means things like, having enough hydrochloric acid in the stomach and having enough digestive enzymes, from the pancreas or wherever, and also having enough bile acids to break down your fats. And again, they're closely linked, not just to the food that you eat, but the stress that you're under as well, right?
Yeah, I mean, you're right. I mean, if you have, if you're in a state of chronic stress, that will affect these, especially the stomach acid. So many people have low stomach acid, and the question is, why do so many people have low stomach acid? And there could
Mm,
be factors like H. pylori, which could affect the gut. Also, could be a factor in Graves' Hashimoto's. Even the literature shows a potential correlation between H. pylori and Graves and Hashimoto's, but again, stress, just being stressed out all the time could definitely affect the stomach acid. But you're right. I mean, that ties into which obviously you're familiar with, like the 5 hour protocol,
mm,
and I mean, you got one of those. What you just mentioned was the replace
mm,
component of that 5 hour protocol, where you want to replace digestive enzymes, replace stomach acid when it's low, replace those bile salts, even like dietary fiber falls under that replace component of the 5 hour protocol. So yeah, you need to incorporate all of those components: the remove, the replace, the reinoculate, the repair, and then we spoke and talk about the parasympathetic nervous system that falls into that fifth R, that rebalance.
mm. Yeah. Yeah. And I guess leading on from that, to ensure you've got enough hydrochloric acid, you also need to be optimally hydrated as well, right? Because otherwise you won't have the fluid to create the acid within the first place.
Yeah, drinking, I mean, mostly, if not all, water. I mean, I drink some herbal teas as well. I can't say I exclusively drink water, but yeah, definitely want to stay hydrated. Of course, the quality of the water is important as well. Try to stay away from tap water as well as bottled water, not just from a I mean, this ties into our conversation because the xenoestrogens from the bottled water can not only negatively affect the gut, which cause that increase that permeability of the gut, but also you're dealing with endocrine disruptors. So that's the case
Mm,
where like those xenoestrogens can affect the gut, which could affect the immune system and lead to, or at least be a contributing factor in Graves' Hashimoto's. But then also, if you are drinking out of plastic water bottles all the time, that could also disrupt the thyroid gland directly. And I'm not saying that, I mean, if I'm out of town or something, I mean, it's not like I never 100% avoid plastic bottles, but I try my best. I mean, even now, like you could bring your own water bottles I mean, you can't have them filled, but you could bring them. I mean, you could bring them to the airport and they do have, I mean, they're probably not the best filters, but they have now, like, at least here, they have at some of the airports, some of the filters at the airports and other places. Again, is that better than drinking bottled water, like where they're filtering everything, but you're still dealing with the plastic? Again, it's debatable, but
mm.
I'm definitely not a big fan of the plastics because of the impact it could have on, again, both the gut and the thyroid.
Yeah. Yeah. Just to clarify, because I'm sure this is what you meant. um, if you're buying a good quality water and you're buying it in a glass bottle, that's a different story, because obviously it's not going to be leaching the xenoestrogens.
Oh, correct. Yes. If you're buying it in that's yeah. So I recommend, if you're going to buy it in a bottle, buy glass. It's just that these days, so many people still buy plastic water bottles by the case. And again, if you're on vacation and you're drinking it for a day or a few days or even a week or so, again, that's probably not, it's not going to be the end of the world, but it's those who are drinking, again, out of specifically plastic water bottles day in, day out, and especially the children. I mean, I'm not saying that's the reason why more and more children have these conditions, but I think it is a contributing factor, along with other environmental toxicants that we're exposed to on a regular basis. So yes, glass water bottle, like here, United States have Mountain Valley Springs is one of the brands of good quality spring water that comes in a glass bottle. So if you're drinking that, that's fine. Or if you're filtering your own water and then putting it in a stainless steel or glass bottle of your own, that's perfectly fine.
Mm. Yeah. Yeah. So sometimes I'll go away for a week or 2 weeks where I'm teaching courses, and in the UK, that is. And I actually take I've got a countertop water filter. I actually take that with me. People think I'm crazy, but it means I can access the best quality water that I can get. But yeah, I mean, if I was flying somewhere, obviously I wouldn't be able to take my water filter. And if it's, a relatively short period of time, I wouldn't feel too bad about, drinking Evian or Fiji water or something like that, which is a good quality water. But obviously, yeah, the plastic's not ideal. But like you say, if it's just for a short period of time, it's probably not going to do too much harm, if any. But yeah, it's the day in, day out consistency where you really want to be, not exposing yourself to those xenoestrogens.
Yeah, definitely agree.
Yeah. So we spoke about some of the factors that can potentially disrupt the gut microbiome. Is there anything else that you wanted to add to that people should be aware of?
Other factors that can disrupt the gut microbiome?
Yeah. Hey Rebels, did you know I now produce an exclusive No Punches Pulled episode every month? These episodes feature controversial guests who aren't afraid to expose lies, share stories of being gaslit or cancelled, and provide real-world solutions for achieving optimal health and maintaining your freedom. These are the kind of episodes that got me cancelled back in 2022, booted off Facebook, Twitter, YouTube, and even deplatformed from LinkedIn. But I'm still here. And these powerful episodes are available exclusive for subscribers only. For the price of just one takeaway coffee per month, you'll gain access to content the authorities don't want you to hear. By subscribing, you're not just supporting the Radical Health Rebel podcast, you're joining the fight for uncensored truth, education, and inspiration. It's easy to sign up. Just head to the show notes, click support the show, and follow their instructions. Prefer watching your podcasts? You can also subscribe on Substack by searching Radical Health Rebel. There you'll also receive weekly articles and more, all for the same low price. Let's rebel against censorship and the lies of mainstream media. Together, we can build a healthier, fairer, and freer world. Thanks for your support, and let's keep rebelling.
Well, I mean, I don't know. I know we didn't get specific, so I don't know if you wanted to get specific
Yeah, that's
with
so
some of the.
specific.
Yeah, I mean, because we said in general, like I mean, we did get specific with gluten, and I mean, I mentioned like xenoestrogen, so there were a few specifics, but I mean, there are other foods that can potentially impact the gut as well. There's besides gluten, grains in some cases could be kind of harsh, especially corn. There is some research showing that corn can have like a gluten-like effect and potentially affect permeability of the gut. Again, not saying that there's not a time and place for grains and gluten-free grains when someone's in a healthier state. I can't say I never eat some rice or some quinoa, which is a pseudo grain. But when I eat grains, I typically try to make sure they're gluten-free. But when you're healing, they could be a little bit harsh on the gut. I don't know if you'd say really a trigger and but again could at the very least in some cases affect gut healing is what I find. We know about alcohol. Alcohol definitely can increase permeability of the gut, and so if someone's healing, even if even something like red wine, which I'll get a lot of people asking, well, can I have just like a glass or two of red wine per week? Sometimes per day, but but per day is definitely a no. I mean, per week, is it going to prevent someone from healing? I mean, everybody's different, so some people
Mm.
might be able to get away with it, but I would still say to play it safe. You probably want to refrain from drinking all alcohol when trying to heal your gut. Uh, the exception might be like if depending on like what recommendations I'm giving, if someone's taking an herbal extract and it has like if it has some ethanol in it, like it's usually like such a tiny amount that it's
Mm.
not going to. Again, in my experience, it doesn't seem like it's preventing someone from healing. But as far as like drinking alcohol for recreation, I would say to take a break from that. Uh, Sugar, we know sugar can be an issue, and again, I don't know if sugar directly increases permeability. Some say it does, some say it doesn't, but it can increase yeast. It could cause yeast overgrowth, candida
Mm.
overgrowth, other types of yeast, which that could affect permeability of the gut. And of course, can cause blood sugar imbalances. And there's some evidence that just having like blood sugar imbalances could also lead to permeability of the gut. So again, minimizing sugar, especially the processed sugars or refined sugars, nightshades. So, at least in the autoimmunity world, there is some controversy when it comes to nightshades. So we're talking about tomatoes, eggplant, white potatoes, peppers, that they could also maybe affect permeability of the gut, or at the very least, cause inflammation, prevent someone from healing. Again, we're talking about some healthy. I mean, there's definitely health benefits of these foods, and some people seem to do okay. Some people they're not okay with when doing it. Again, I usually recommend taking a break from them while healing just to kind of play it safe. It's not something I recommend for most people to avoid permanently. But from so food standpoint, I mean, there's dairy. I skipped over dairy, which is, of course, commonly recommended also along with gluten to avoid. I couldn't find anything in the research like really being specific about gluten causing leaky gut, causing increased permeability, but people definitely have sensitivities. A lot of people have sensitivities to dairy, and we could argue, well, there's healthier forms of dairy like raw
Mm.
dairy or dairy from a cow or sheep. I'm sorry, from a sheep or a goat. But I do recommend also taking a break from dairy while healing. So those are some of the foods that potentially could have a negative effect on the gut. Some of them are in the research, some of them are more theory, and maybe just because maybe they won't necessarily cause a leaky gut, but can cause inflammation, which could indirectly, maybe not cause a leaky gut, but still we don't want inflammation in the body uh, if we could avoid that. But yeah, so those are some of the foods. I could talk about some of the other factors, but I didn't know if you had anything to add to the foods that I just mentioned.
No, no, no. Carry on.
Okay, so let's talk about toxins, toxicants. Again, toxicants are kind of man-made. So like again, the xenoestrogens we were talking about, toxins like mycotoxins from mold would be an example of a toxin, and not every toxin and toxicant can negatively affect the gut. At least I don't think that's the case. But according to the research, xenoestrogens can, as I mentioned earlier, and this includes things like bisphenol A or BPA, phthalates, flame retardants. We've heard of microplastics these days, which could be a factor. Uh, Heavy metals such as mercury can affect the gut, permeability of the gut, and also can directly affect the thyroid as well. And then I think when I was doing my research, cadmium has been
Mm-hmm.
shown to affect permeability. I mean, others like aluminum definitely affect immune system. I don't know if aluminum affects permeability. It wouldn't be surprising if it does. I just couldn't find anything where aluminum and even lead, again, I forgot if that directly causes permeability. Obviously, even if it doesn't affect the gut directly, there are other harmful effects of these heavy
Mm.
metals. So you want to try to minimize exposure. Really, with all of these, it's just a matter of trying to reducing exposure. And then, I mean, we could do things to detoxify, but glyphosate, the active
Mhm.
ingredient in the herbicide Roundup, so that could definitely, at the very least, can cause dysbiosis, imbalance in the gut flora. Certain medications. So we know about antibiotics, and then there's acid blockers that could affect permeability of the gut, not to mention also you're blocking acid, which is important for digesting, breaking down the minerals and the protein. But then anti-thyroid medication has been shown to affect permeability of the gut. So anti-thyroid
Mhm.
medications, methimazole, and PTU. And in the UK, they actually use carbimazole, which converts into methimazole. So, yeah, so those in the research do show that they can affect the gut barrier in a negative way. And so it doesn't mean that people should never take anti-thyroid medication. Again, it's like antibiotics. There's a time and place, risk versus benefits. I do have a good number of people on the anti-thyroid medication, and the goal is to try to improve, in the case of Graves' disease, their immune system health. So they need less and less of the anti-thyroid medication, and so it's yeah. So again, there is that time and place, but I thought was important to mention it. On the other hand, thyroid hormone replacement does not increase permeability. So if someone is listening to this, watching this, and if they have Hashimoto's, then again, if you need to take thyroid hormone replacement, not everybody does. That's not a concern, but the anti-thyroid medication can have that effect. And then I mentioned mycotoxins from mold.
Mhm.
There is some evidence that mycotoxins can affect permeability of the gut as well. And again, you can't possibly avoid all of these. There are too many toxins and toxicants out there, but you can do things to minimize your exposure. So we spoke earlier about trying not to drink out of plastic water bottles, at least on a regular basis. And then, there are other sources of plastics as well. It goes beyond the water bottles. And then, I mean, heavy metals. like, There's, I mean, some people still have like the silver fillings, mercury amalgams, and so that could be a source. Even the methyl mercury in fish could be a
Mhm.
concern. And again, that everybody has their own perspective. Well, should we completely avoid the seafood, or should we just minimize the seafood? I can't say I eat a lot of seafood, but I think again, it's most people could have a few servings of like not larger like fish, like swordfish, but things like salmon, sardines. Again, you're not going to escape the heavy metals, and then there's other things like microplastics. That's the problem. It's not just the heavy metals when it comes to the seafood. So yeah, but like I said, we can make that argument with a lot of foods too. There's so many toxins in our food. We just need to try our best. The glyphosate, I'm not sure. Is glyphosate an issue in the UK like it is here in the United States?
So they passed a law in 1999 to ban GMO foods in the UK. Now, I don't know if that's still the case, but they definitely sell glyphosate as a weed killer for your lawn.
Hmm.
Now, whether they use it on farms, I'm not 100% sure. When I last looked, it was illegal, but I kind of think they probably are using it.
Okay.
My guess is they probably are. Whether it's legal or not, I'm not 100% sure. But my guess would be that they probably are. They're definitely selling it in stores for people to put on their lawn. That's for sure. But I think it's less of a problem if certainly in the US. But yeah, not as much of an issue, but it might still be an issue.
Yeah, but I'm sure you heard this, but some when having a gluten conversation, some wonder, is it more of a
Mm,
glyphosate problem, especially because there's people who have problems with wheat in the United States, for example, and then they go overseas, maybe the UK, maybe somewhere else
mm,
overseas, and they eat some pasta that's not gluten free, and they feel perfectly fine. And
mm,
you can't always go by symptoms, but what the story for some of these people is that they felt horrible eating the wheat in the United States, but not elsewhere. So the question is, was it the wheat that was the problem in these situations. Obviously, wheat is a big problem with a lot of people, but in
Mm.
some situations, is it more of a glyphosate issue? So I was just curious if over there. So it sounds like that it was banned. They still use it in Roundup for the lawns. Not supposed to be in food, but sounds like you're questioning whether or
Mm.
not it really is
Yeah.
as far as the GMOs. So yeah.
Yeah.
But I mean, eating organic will help. I mean, here it's not going to completely eliminate the glyphosate, but obviously you just want to do everything you can to minimize your exposure to glyphosate. Again, along with other toxins, the mold I mentioned is a big issue. A lot of people have mold and they don't know about it because
Mm.
they don't have any sign of water damage in their home, and but it could be behind walls, it could be underneath floors, and it could also come from the food. It's not only
Mm.
airborne mold, but so that could be kind of like a hidden leaky gut trigger,
Mm.
just the mold that you're missing, or again the mycotoxins from the mold. And so those are some of the factors when it comes to toxins, toxicants. There's infections. So certain infections can affect permeability of the gut. We have, I mentioned H. pylori, which the concern with H. pylori is not the effects only on the permeability of the gut, but again, it also blocks stomach acid production. And there's definitely controversy when it comes to H. pylori. Some will
Mm.
say, don't treat it. It's commensal. It's fine. Others will say, yes, you want to treat it. I mean, as I mentioned earlier, there are multiple studies in PubMed showing correlation between H. pylori and Graves and Hashimoto's. And I realize correlation doesn't always mean causation,
Mm.
but when I see it in my patients, I do recommend treating it. Now, I usually don't recommend like the therapies that they give because it's multiple antibiotics,
Mm.
like triple therapy, quadruple therapy. So that I recommend, if at all possible, avoiding. Again, I'm not saying there's never a time and place for that, but I would recommend trying to treat it naturally using certain natural agents for H. pylori. And then there's parasites that potentially can, again, some debate. Some will say treat everybody for parasites. Others will say selectively treat people for parasites. But and definitely in some cases, parasites could have a negative effect on the gut. Do they have a negative effect on the gut in all cases? Again, questionable, not just my opinion, but other experts I've had when I have on my podcast. So so yeah, but those are some of the factors. And then there's I mentioned yeast overgrowth, so candida and other yeast, and then there's SIBO, small intestinal
Mm.
bacterial overgrowth, which is too much bacteria in the wrong place, which is the small intestine. Most of the bacteria should be in the large intestine. So so yeah, those all these factors. I mean, this is an all inclusive. There are other toxins I didn't mention, other infections that I didn't mention, like Giardia. This is another one that comes to mind that can affect permeability. I mean, I'm sure other foods. I mean, there are things also we just don't know about too that we'll find
Mm.
out in the future that maybe we think now is okay to eat or get exposed to, but potentially can increase permeability. But again, you can't avoid all these. All you could do is is just minimize exposure to environmental
Mm.
toxins, infections. Again, trying to optimize the health of your gut. Whether again, because like I said, there's some that will say you want to live in harmony with things like H. pylori. Others will say you want to eradicate it. But either way, even if you treat H. pylori and get rid of it, it's not like you can never get it again. So it
Mm.
is really all about having a healthy gut, healthy, like you said, healthy enzymes, healthy stomach acid, healthy a good number of good flora, the bile acids. All of these things help to also keep negative. Help to keep the more harmful bacteria in check, or again, like normal bacteria from becoming opportunistic in the gut.
Mm. Yeah. I mean, for people listening, it might sound like, oh, geez, there's so much that can go wrong. There's so much that can affect me. But actually, when you look at it, it's actually quite simple, right? So in the system that I use, we have 6 foundation factors, and they're in a hierarchical sequence. Number 1 is positive thoughts. You could put not being too stressed within that as well, I would say. 2 is optimal breathing. Again, that's going to come with stress too, right? If you're stressed, you generally breathe too fast. So slowing your breathing down and use your diaphragm to breathe rather than your chest and shoulder muscles, what are called your accessory respiratory muscles. Optimal hydration is 3. Optimal nutrition is 4. Optimal movement is 5. And optimum sleep and rest is 6. Keep it simple. And then if you want to, obviously choose good products to put on your skin or on your hair if you had hair, unlike us too, or if you wanted to, make sure you're using minimal toxins in your home cleaning products and things like that. That would be a good thing to add on to those foundations. And then there are things that you can do if there are toxins in your body to help them come out as well. Again, it can be simple things. Exercise, right? So toxins can come out through your skin via sweat. They can come out of your lungs via breath, right? Exercise is great for both those two. Sauna is really good. So there's some relatively simple things that people can do. So what I'm trying to say is it doesn't have to be complicated, right? You can make it quite simple. And kind of leading on for that, and I'm sure, you treat every client as an individual case and everyone's different, but what kind of general approach do you take to heal the gut and the thyroid with people?
Yeah. Well, I mean, first of all, I want to say those, what you mentioned, the 6 factors that you just mentioned are, I mean, I agree that the mindset we a lot of times tend to overlook. Having that positive mindset is extremely important. And also the movement too. I want to reinforce what you said. I mean, everything that you just mentioned was important, but like, for example, someone who has constipation, there could be numerous causes of constipation. It could be thyroid, it could be hypothyroidism that's causing constipation, could be diet, but it also could be because you're just sitting all day and you're not moving. Because I find that when I move, like I now we're sitting as we conduct this interview, but I do a lot of my work on a treadmill desk where I'm walking and working, and that definitely I know that helps to keep me regular as well. In addition to staying hydrated and eating well and everything else. But yeah, to get back to the question as far as the approach I take, so I definitely start with having people incorporate those diet and lifestyle factors. So again, a lot of what you just said. So diet, stress management. I mean, the breathing is really important. So I'm glad you brought that up. The regular movement. I also usually encourage like some type of like resistance exercise. Doesn't mean like heavy weightlifting or anything like that. It could be, but while healing, usually I'm not recommending that like to go really heavy, but just just doing things from a diet, stress management, sleep perspective, doing all the basics that you pretty much said is where you start with. Because if you're not incorporating the basics, it's really going to be difficult to heal. I do like to do testing. Again, I don't go crazy with the testing, but I usually do like to do some type of adrenal testing. I do comprehensive blood testing, looking at not just the blood count and metabolic panel and lipid panel, obviously thyroid and antibodies I look at, but also like vitamin D and B12 and an iron panel and inflammatory markers like CRP, homocysteine. And then it does depend on the person. So I can't say on everybody I do gut testing. I mean, some people, I mean, I certainly do my share of comprehensive stool panels, like GI map or sometimes GI effects. There's a time and place for SIBO testing. There's a time and place for mold testing, looking at mycotoxins. And that's part of the health history to kind of see what else might we need to do in addition to having the person focus on a diet and lifestyle. What do we need to do to find some of the potential triggers and underlying imbalances? And then, I mean, based on the test results, in addition to diet and lifestyle, there might be some specific recommendations I give based on the test results. I mean, for the healing of the gut, also that 5R protocol that I mentioned. So, there's the remove, replace, reinoculate, repair, rebalance. A lot of people overlook that first one, though. At least maybe not practitioners as much, but definitely you see people who are taking digestive enzymes on their own and probiotics, and they're drinking bone broth, and it seems like they're doing everything. And it's like, oh, my gut's not healing. Why not? And it's because, well, maybe you haven't removed the factor that's disrupting the gut, whether it's
Mm,
gluten or, again, trying to minimize the exposure to those toxins and toxicants we mentioned. Maybe they have an underlying infection that's affecting the gut. So I definitely will incorporate that 5R protocol, try to find the factor that's disrupting the gut while at the same time replacing whether it's low digestive enzymes or low stomach acid or bile salts. Again, re-inoculate, combination of prebiotics, probiotics, fermented foods, repairing with things. Yeah, like I think bone broth's great. There's a time and place also for some agents like glutamine and DGL licorice, and there are other things that could help support the gut. And then again, that rebalance through mind body medicine, vagus nerve exercises. I mean, so one thing also with reducing toxic load, you mentioned sauna, which I love
mm,
sauna. I try to do infrared sauna 3 times a week, not just for reducing toxic load, but great for circulation and
mm.
all that too. So yeah, if someone can incorporate that, even if, though I will say if someone has hyperthyroidism and if it's not managed, you want to be careful about going into the sauna because the sauna will increase your heart rate. And
Yeah.
so if someone already has an elevated heart rate, you might want to you probably want to get that under control before going into a sauna. And so, I mean, that basically, again, so diet and lifestyle, always a priority, doing typically some testing to try to find some additional answers and then giving recommendations based on the test. Again, I mentioned a 5R protocol. The other thing I will mention, and I think I mentioned briefly, but when you're dealing with a thyroid condition, we want you to be safe while healing. And what I mean by that is, like in the case of hyperthyroidism, Graves' disease, if someone has elevated thyroid hormone levels, again, you want to manage that, whether it's through the anti-thyroid medication I mentioned earlier, or there are natural agents. I took an herb called bugleweed that helps to lower thyroid hormone levels. I also took motherwort, which is kind of like a natural beta blocker, not exactly the same, of course, but I took the bugleweed, the motherwort. If someone has really low thyroid hormone levels, again, thyroid hormone is extremely important for every cell tissue in the body. So there is a time and place for thyroid hormone replacement. I do think it's probably overprescribed, but again, not to say it's never necessary. So yeah, did want to throw that in as well. But yeah, essentially, those are the steps and approaches I take to help someone heal their thyroid and heal their gut.
Mm. Yeah, I mean, it's interesting hearing you speak because it's almost like I'm I'm looking in the mirror talking to myself, right? Because your approach is almost exactly the same as mine. Um, I'm like yourself. I don't like, doing loads of testing up front or anything like that. Um, I try and keep it to a minimum. You
Hmm.
know, I don't like my clients spending money for the sake of spending money.
Yeah.
If I think it's worth doing a test, like I was working with a client the other day, and I said, look, I think it would be useful to. So there's two tests. I was kind of thinking, yeah, it would be definitely not essential, but it would be nice to know if if this client had particular heavy metals, and if so, which ones, and also some other environmental toxins. But I said, look, if I'm honest, I don't think it's going to change the protocol that you're on anyway, right? But I said, look, if you want to know, feel free to order the test, but I don't think I necessarily need it. But if it's going to make you feel a little bit better in yourself, then you can order the test. So that's kind of my view. I think metals sometimes can be useful, to know which specific one. It might speed up the process a little bit. But yeah, it
Yeah.
sounds like we've got quite a similar approach, really.
Yeah, I agree. I definitely try to be more conservative with the testing. And like you, I also give them options. So maybe I'll talk about a stool test, but I don't know if it's really absolutely necessary. But sometimes we don't know too, to be honest.
Mm,
Like we might recommend like some basic tests. And if the person's not improving and they're doing everything from a diet and lifestyle standpoint and doing everything based on the findings of the test and they're not improving, maybe we need to dig deeper. And I learned years ago, I had this one patient again years ago, this story about how he wasn't improving. He had a Graves' disease patient, his antibodies weren't decreasing, and he felt great from a gut perspective, like no digestive symptoms at all, no pain, no gas, no bloating, regular bowel movements. And at the time, again, this was quite a while ago. I mean, I was like, well, we could do a stool test, but I mean, you're feeling great. I don't think it's going to show anything, and they're not cheap to do. So again, long story short, I didn't recommend a stool test, and he stopped seeing me. He saw another practitioner who did a stool test, and they found a parasite, or they found parasites on the stool test. They put him on a protocol, and he got and again, I just know this because we communicate through email. And he said, so I didn't see the findings, but I don't have any reason to see why he would not tell me the truth. And he said that the antibodies normal, he got into remission. And again, I made the mistake of completely dismissing doing a stool test. Again, I think it was not a bad thing that I didn't jump into the stool test, because like you, I'm conservative. I'll definitely do a stool test when I think's necessary, as well as other tests, but I am conservative and don't want the person spending hundreds or thousands of dollars if unnecessary. But in this case, again, I looking back, when this person wasn't healing, and again, it's just an example that you can't always go by symptoms. Sometimes the person might have something underlying that could be an issue. And but yeah, I just wanted to share that, because again, I don't recommend stool tests on everybody, but even if someone's not experiencing symptoms, sometimes there is a time and place to do them.
Yeah. Yeah. Excellent. Excellent. So, Eric, what's next for you? Don't tell me you're going to write another book.
I will eventually. So not anytime, not this year. So when this episode's released, there won't be another book out. But eventually, I do want to write more books, health related books, and yeah, probably thyroid related books. So what's next? I mean, I still obviously I'm passionate about helping people with hyperthyroidism and Hashimoto's, Graves' disease, Hashimoto's. Plan on continuing to work with people who have these. I have live events a few times a year. Many times they're free, like 5-day boot camps and challenges. Sometimes I do others that are like low cost. Uh, but but yeah, so and I have my own podcast, Save My Thyroid. So I'm continuing to work on not having just guests, but what I've done lately is had people dealing with Graves and Hashimoto's, just people who, not even patients, but just like people who I like, just kind of like go through like some of their major health challenges. So trying to do some different things with the podcast, and also have a newsletter, which is fitting for this episode. Healthy Gut, Healthy Thyroid, which people could check out by visiting savemythyroid.com/newsletter. And so yeah, that talks more about what we're discussing here, the relationship between the gut and the thyroid. And so, yeah, those are some of the things that will be next for me.
Fantastic. And where else can people find you online, and where can people buy your books?
So, I mean, they could just visit Amazon to buy my books. And again, savemythyroid.com. I have two websites. My first website, naturalendocrinesolutions.com, is about 15 years old. And then when I came out with my podcast in 2021, and I called it Save My Thyroid, I'm like, yeah, SaveMyThyroid.com is so much easier to remember than NaturalEndocrineSolutions.com. And I wasn't quite sure what to do. And NaturalEndocrineSolutions.com has a lot of articles and blog posts. I'm like, I'll just keep that as the written material for written material, written resources, and then put all the podcast episodes on SaveMyThyroid.com. And of course, you could find it on Amazon, not Amazon, on Apple Podcasts and Spotify. Have a YouTube channel as well. So if you just look for Eric Osansky on YouTube, you'll find me. Have a couple of Facebook groups as well that related to thyroid health. So yeah, you could find me in all those places.
Excellent. Excellent. Eric, thank you so much for coming on the show and sharing your experience and wisdom with the audience. It's been really great chatting with you.
Thank you so much, Lee. This was a great conversation. Again, I appreciate you having me on.
Thank you. So that's all from Eric and me for this week. But don't forget to join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.